Good morning, everyone. We'll give folks a couple of minutes to join, and then we'll get started. All right, everyone, good morning. Just a quick agenda review. Like always, we'll go over the dashboards, get a health officer update from Dr. Velasquez, general response updates with Lindia Wilson, a GSI report with Alicia or Kara, and then any open discussion items that you would like to add in. I know one area that we've received a lot of questions about is related to a big jump in numbers between, I think, the 28th and 29th last week. And so I'm pretty sure that Steve and Dr. Velasquez will touch on those during our conversation. But any other things that you want to make sure we cover? All right. Well, Steve, if you want to go ahead and start off with data.
Good morning, everyone. So for the week of January 24th through January 30th, we had 1,581 new cases reported. That's a slight increase from the prior week of 1,422. That did include the one day that Amelia was referring to there, which was kind of a large data dump day. That put our daily average at 226 as opposed to 203 the prior week. Of those tests, or of those positives, there were 1,347 that were confirmed or PCR, 176 that were probable or antigen, and 58 that we're still waiting to assign. For the 2-week total, so that is between January 17th and 30th, there were 3,003 newly reported cases. The prior 2-week total, that was January 10th through the 23rd, was 3,430, which is about a 12% decrease. Age groups impacted most still remains about the same. The 20 to 29-year-olds and 30 to 39-year-olds make up about 40% of all new cases. Our rate per 100,000 of newly diagnosed cases in the past 2 weeks has gone down to 583. It was 666 last week. That's a 12% decrease. And the non-adjusted, so just confirmed cases, would have been 526 per 100,000 versus 641. New hospitalizations, we had 47 new Spokane County resident hospitalizations between January 24th and the 30th. That is a decrease from 58 the prior week. It's a 19% decrease. Currently hospitalized in Spokane County, so that's residents and others, are 113 individuals. Unfortunately, we did have 13 new deaths last week, an individual in their 50s, 6 individuals in their 70s, and 6 individuals in their 80s. There were 34 deaths reported the prior week. Our testing numbers have improved. Our total test for the week of January 14th through 20th was 8,443. Average number of individuals tested daily was about 1,206. That's a slight decrease, but our test positivity rate has gone down a fair amount. The average positive test for that period of time was 14.2%. That's a decrease from 19.4%, and then 2 weeks ago, I believe that was about 25 or 26%. So big improvements there. For the healthcare system readiness, as of yesterday, there are currently 1,048 staff beds, 1,501 licensed beds. Of the staff beds, the total occupied census is 85.6%, and the total COVID census is 10.8%. For licensed beds, that is a total occupied census of 59.8% and COVID census of 7.5%. And there are currently 9 surge or overflow beds in use. Our SRHD staff investigated 778 cases last week, which is a slight increase, and we reached 66 within 24 hours. We continue to support people for isolation where they need it at our 2 facilities. Currently at the hotel facility, or as of yesterday at 4 p.m., there were 15 individuals, so about 42% occupied. And at the Immaculate Retreat Center, there were 26 individuals there, which is about 43% occupied. Our business technical advisors continue to work with businesses in the community. To date, so between May 30th and January 31st, they have done 5,741 consultations. In the prior weeks of January 17th through 31st, they completed 161. Food security remains about the same. There were 423 new applications for EBT, and Second Harvest distributed about 240,000 pounds of food, and our child care metrics remain flat at the same. For unemployment insurance claims, there were 1,135 new claims for unemployment insurance. Industries impacted most were food services and drinking places, specialty trade contractors, and social assistance. And then finally, for protecting high-risk populations, our number of outbreaks in long-term care facilities. To date, there have been 87 outbreaks in those facilities. There are 28 that are considered in active outbreak status. We had an increase of about 7 new facilities in the prior week. And that concludes my report. Happy to take any questions.
Any questions for Steve? Oh, go ahead, Commissioner Cuny.
Yeah, Steve, I have a question for you. So a situation came up with some friends of the family that they had a daughter test positive on an antigen test, so the rapid test. And then 2 days later, so then they had her take the molecular test. And so then she was negative on that. And so I guess I'm just, how does that get counted in the testing?
So for the testing rates that I report, that wouldn't have been counted. It would have been counted as a negative.
Because you guys then match those up to, is that kind of why it's probable?
Yeah, so that's why it's probable, because the antigen test we consider as kind of surveillance testing as opposed to the confirmation with the molecular, and that we only count the confirmation testing in our test positivity rates.
Okay, great. Thank you.
Amelia, I have a question.
Go ahead, Katie.
So I've been following the governor's metrics, and we've satisfied 2 of the 4. This may not be the right time in our meeting to ask this question. My question is, are we trending in the right direction to get another metric so we can move to phase 2?
From what I'm seeing, yes, we're trending in the right direction on pretty much all metrics. So And to understand that what the governor's office is doing is that there is a bit of a lag compared to what I report. That's just because the Department of Health wants to confirm all the cases and do the proper channels there. So we're a couple weeks ahead of their reporting on that end when we do it, and that's just our preliminary. That's so we can get it to you as fast as possible. But I would say that we are going in the right direction.
So my understanding is that on February 12th, the governor will do another release of the status of the different areas. And so it's good to hear that we're heading in the right direction. Thank you.
Yes, and then they report that they actually send out, like, it's a PDF of where we are and then where the whole state is by region. So we get that, I believe, every Friday here at the health district. And then, Steve, there's a question in the chat about creating a section of the SRHD dashboard with the 4 metrics. Do you have thoughts on that?
My concern with that is that we are reporting the cases a little bit differently than they are, and I would be concerned about kind of not having consistent data between the two. We're really relying on DOH for their metrics as they're doing the phase assessment. It's something that we can talk about, and then some of this data, we don't have the same access that DOH does to it.
I know that we do send out the PDF. We could probably post that onto or like link it to the website. I know that I've been having conversations. I think that there is some community misunderstanding about who, the SRHD does not determine those metrics or how they're calculated. That came to us from the governor's office and DOH. So it's not something that we came up with. So I know I've been trying to clarify that for some different business owners so that they have an understanding of that.
And we do have a link to that, their dashboard as well on our website. If you go to the Roadmap to Recovery dashboard, when you click on COVID-19 data, it'll take you to that new 4 metric dashboard as well.
And then Commissioner Kearns put a question in the chat. If the state is using 2 to 3 week old data for their metrics, shouldn't we know now if we'll be moving forward?
I would say we have a good idea. I don't know 100% that it's going to match up exactly, but I say that we know the trend. And in the trend that we are, going in the right direction.
Any follow-ups with that?
No, Amelia, that'll work. I'll have some follow-up questions about comparing our data to their data, just trying to get a way for us to be able to monitor, and having to look at the state's dashboard might just be the way we have to do it. I'll follow up if anything else is needed. Thank you.
Okay.
One thing that I do want to point out is that for the cases, they report on specimen collection date. That's how they do their case rates, where we do report date. The reason we do report date is that we want to give you guys daily updated metrics. If we were to do specimen collection, we'd probably be a few days behind to even a week or 2 behind, which is why they're using that 2 weeks back. So that is the difference between when they say our cases per day are for every 2 weeks and our cases per day are every 2 weeks. In some senses, that does flatten it out. So we had that one day where there were, over 600 cases reported to us. A lot of that came from a delay in the way we got the data. There was delays in their system that came to us. And so we reported it on the date that we had a confirmation. But if we were to look through each one of those cases, it would probably spread out the days that the specimen was collected.
Kelly put in the chat where you can actually link through the SRHD website to that information in dashboard to the Roadmap to Recovery. And Alicia, I think you came off mute. Maybe you had a question. Want to make sure we get everybody.
Well, it's tied up in all of this, and it may be for even later conversation, but I think that, so the number one thing is 2 things that we're hearing. One is, the perception, although we've been advocating for, less of back and forth, and we've been advocating for, not having to move all 4 metrics, but now there's still this perception that, the governor's moved the goalposts again, and we're never going to get there. And so the lack, kind of this reentry of the sense of hope, even with the changes in the roadmap. And so one of my kind of questions for us is how do we collectively come around that? And I think and that's layered on with what both looking at the dashboard and who got to move forward last week, this mounting perception of inequity between those of us that are border related communities and those counties who don't have a border, because if you look at the state map, whether it's Canada, Idaho, or Oregon, we're all still stuck in phase 1. And so is there some opportunity to collectively coalesce around that and that gap? And so I think that those are the 2 questions, when it's the data, the dashboard, politically. I just got texted a statement that the Peninsula lawmakers made this morning around the confusion of the metrics. So I think that that's just a kind of 2 big overarching questions and feedback. Thinking about the 4 different phone calls I fielded yesterday from small business owners, all in that same context, and wanting to be part of the solution still, but really struggling for optimism.
Yeah, I think that's a really good discussion that we could have here. Maybe, if we want to continue that at the end, I can say, here at the health district, we did not, I think we had a meeting at like 9:30, and then the new roadmap to recovery was announced at like 2:30. So, the health districts didn't have a lot of input into, really no input into the new roadmap to recovery. But I know, like, one of the questions we were trying to figure out is, even in terms of like that percent positive rate, there's some really large metro areas that have low numbers, which just seems off, right? Like, it seems off that King County would be able to be so low right now. So I agree. I think it's a conversation, because it does feel like 2 steps forward, 3 steps back. So let's maybe circle back around to that at the end, and we can hear Dr. Velasquez's report, and that may help us kind of frame that conversation.
So good morning. I guess I didn't get the cue. Apologize for that. I was listening intently. So good morning, everybody. So let me just mention a couple of things that maybe will give a little bit of context as we continue this conversation. So a couple of weeks ago, we started to look a little bit more into the positivity rate. And our goal was to make sure that if there is a number, that number is as accurate as possible as it can be. So we have spent a little bit of time looking at the positivity rate over the last couple of weeks. And that includes not only the information that we have, but also speaking with our providers and making sure that all test results are being reported to the state, including negative. And I think the good news is our providers are working very diligently to make sure that happens. And we've been tracking back and forth to all of them. So to the best of our knowledge, the positivity rate as it sits right now seems to be accurately reflecting what we have in the community, with the caveat that Steve mentioned, that there's a little bit of lag between reported and collected, because as you remember, it may take 2 or 3 days to get a result. So the collection date may be 3 days ago and the report is today. So there's a little bit of a differential. But at the end of the day, we're making sure that everything is being reported and to the state, since the state is the one that actually determines what the positivity rate looks like. So I was very encouraged after I spoke with all of our providers, and they're all double checking and triple checking and make sure everything goes in. Most of them have electronic interfaces, so things do move quickly, real time because of that. And we also looked at the current level of antigen testing, which is not high enough to actually dilute out the positivity rate. as we continue to move more into antigen testing into the future, then that may be a different conversation. But I wanted to circle back to that and mention that. Now, the good news is, as Steve mentioned, our rates as well as positivity are trending in the right direction. And I wanted to mention the rate per 100,000, which is a good indicator of where are we moving to as a community. So if we look at the highest peak a couple of months ago, which was November the 29th and December the 6th, that was about 908.7 per 100,000. When we look at today at 583, there's actually a 37% decrease. That's better than 1/3 change in basically less than 2 months. So if we continue doing that, I think we will continue trending in the right direction. Occasionally, we may see, because of backlog on reporting, a spike like we saw on January the 28th, which doesn't mean we had really 427 cases that day. It only means that 427 cases were reported that day because of a backlog that includes airway heights and a number of other areas. So I think that's number one. And what that tells me is that people are taking to heart the guidance that we're providing. And I've heard pretty much all of our elected officials echoing that. Now is the time to do the facial covering, social distancing, step it up, don't relax that. Second, with the increasing number of vaccines we have in the community, those numbers should continue to get better. And the only area where we still have some concern is, as Steve mentioned, the 20 to 49, which is like 42% of all cases. Because that tells us that the kind of like community and socially active group is carrying the bulk load of the positivity, even if they're not carrying the bulk load of disease, because typically disease in that age group is less severe than in the more senior population. So I will appeal again to our millennials to do follow all the protocols. And I know that Alicia has echoed that with our businesses to make sure that customers, employees, are following the rules, and I know they are, because otherwise the rates wouldn't be changing. But what happens before and after work is what worries me a little bit, because we have less control over that, and that's where we see the positivity rates. And then we hear the stories, well, 5 of us got together, and then each one can infect another 7 to 10. So, it escalates from there. So I'm not picking on that particular age group, just pointing out where we have an opportunity to maybe have a conversation. And I do know, as I mentioned, that not only our elected officials, but our community leaders keep having that conversation wherever they can. So for our businesses, I'm an optimist. The light is getting closer. We can see it. We couldn't see it a few months ago. We just need to keep working on that as we go. So a second point that I wanted to talk about, and we can continue a conversation about this a little bit later, but I want to give you that summary about the positivity rate and close the loop on that particular issue. And we'll continue tracking that. And we'll continue having conversations with our providers. We're all in contact, making sure that if there's anything that we need to know in terms of reporting, either delays or any other anomalies that we're aware. So all of our providers are aware of that, and we're all watching very closely that number. So the second thing is today's paper, front page, schools. We continue to spend a lot of time with our schools, not because we approve their plans, but because we do provide guidance. And I do want to say thank you to all of our schools, school superintendents, principals, officials from school districts, private schools, parochial schools, other types of education, because they're doing a good job and we're getting all the data that we need to provide them that guidance. And as long as we continue doing that, we'll keep the schools safe. And it's important that we do that because we don't want the numbers to increase there. So keeping our fingers crossed that continues to move forward, particularly as we look at other activities such as music and sports, limited, of course, because it is important that we bring those to the table, and we have some guidance on those too that has been provided to the schools. So I wanted to mention that because I don't want to lose sight of that kind of gain for the community, that we were able to bring many of our students back, and we'll continue to bring students back. That's an important movement for the community. Concurrent with that, we've spent the last week or so doing some research on testing programs around the country in schools, K through 12. Specifically, not higher education. We have a good handle on that. And there are various models from Dallas and Michigan and New York and others that we've analyzed. And we have actually developed some tentative parameters for on-site testing at schools that could happen in the very near future. We do have to work through some of the logistics of CLIA exceptions and so on and so forth. CLIA is the Clinical Laboratory Improvement Act of 1988, which governs all laboratory testing in the country. So there are some nuances that we have to work with, but we're working through that. And the reason why I bring that up is because we all know that younger learners are not going to be immunized for some time. So if we can do the public health guidance and testing, kind of like bookend that way, we'll continue to keep our schools safe. So more to come on that as we move forward. And we're trying to move that as, I don't want to say as quickly as possible, we're trying to move that in a stepwise manner, in a way that it will be beneficial as opposed to confusing, because it could get confusing depending on how you do that. And my last point in there is that it's not a one-size-fits-all. It's nuanced, and there's a certain level of customization that is going to be required depending on the schools and the programs. As an example, a traditional classroom is going to be different than a special ed classroom, for example. And we have all of those nuances are being considered in what we do. And then lastly, although I know Lydia is going to talk a lot about vaccines, I just wanted to make a comment because I know that we all probably, everybody in the screen and us included, Amelia, Linda, and I and the team, we're getting lots of questions about vaccines and lots of calls. And I do have to say that we're all doing as best as we can, as much as we can, and supporting each other. Our mighty vaccine team is basically 3 people, although it seems like it's 100, but there's only 3, and they're working very hard. The biggest issue that we still have is not knowing what the allocation will look like from week to week. As an example, this week we did not receive any. So we're working on the fumes of what we had left from last week, and we actually had to share some of that with the arena because their shipment didn't get here on time. So these are the nuances. Not that I want to bore you with the details, but it is a very complicated process right now. And I think we're all trying to get as many vaccines on arms as we can. And that's the ultimate goal. And who gets it to the arm, it doesn't matter as long as we can do that. So I know that Linda is going to talk a lot about vaccines, but I wanted to reassure you that we're all in the community working together on that. And we're supporting each other and we're backing each other up when something happens or when something doesn't happen. And more to come on that. I get a lot of calls, particularly from people like, I couldn't get an appointment, I'm not sure what to do. And we're trying to help people navigate that. But I will urge all of us to be a little bit patient. I think be somewhat patient. I know that we did encourage everyone, and we still encourage everyone to get immunized when it's appropriate for them to do so. But we also know that the demand right now and the supply are not a match by a big number. So let's keep working on that. Every day is one more success on the vaccine front. And if we keep doing that and keep moving forward, got back to Alicia's point, and that is kind of like it's going to shine the light at the end of the tunnel a little brighter, because the quicker we get to a high number of immunized people, particularly those at risk, the sooner we're going to get this thing under control. So with that, I'm going to stop here and see if anybody has any questions. I just wanted to add that because I know is a point of concern for all of us, and I understand why, and we're trying to do the best that we can with all of the things that we're juggling right now. And I just wanted to do a shout out to our mighty team of 3, which is out there, actually, technically out there right now, doing what they do. Any questions for me? Well, thank you.
Thank you, Dr. Velasquez. Lindia, he set that up perfectly for you to talk vaccines.
Yes, he did. Good morning, everyone. So just like Dr. Velasquez said, really our work has shifted from the focus on cases and contact tracing and testing to vaccine. So we are working to build up our internal task force so that it's more than just the 3 original immunization outreach staff. So we've reassigned some staff. We've hired a couple of positions in the from COVID dollars, and really trying to support them with other staff. So really, this is going to be my biggest update is around the vaccine and helping you understand kind of the work that's going on, some of it, most of it, out of our control. And it's shifting every day. So our plan has been working with our primary vaccine enrolled providers, and it really has been Kaiser, Multicare, Providence, Chas, Unify, the Health District, and then the pharmacy that was doing long-term care is Prevention Northwest. Some of the pharmacies have signed up, Albertsons, Yokes, and Fred Meyers, and some smaller healthcare providers signed up to really vaccinate their own staff and their patients. So that's the work that we've been doing, is really advocating for people to get signed up and get the vaccine out. So the state plan has kind of emerged as we've been working, and we haven't always been aware of what their plans have been. So they did focus on enrolling providers and pharmacies, but then they also just recently set up these mass vaccination clinics. So there were 3 clinics that were already in the works in the state, and then they added 4 additional ones. So that's 7 large mass vaccination clinics in the state. They had this federal pharmacy agreement that they were working with the long-term care, and then they continue to look at public-private partnerships. And those are the ones that we're not always aware of. So just recently in the news, there was an announcement of OSPI working with Kaiser and vaccinating all teachers when they get to that phase. So as these things come on board, the vaccine gets spread out and doesn't always come to the original enrolled providers. And that has been probably our biggest frustration, because it's really hard to plan when you can't rely on the vaccine that you were getting and then all of a sudden aren't getting any. So just to give you an idea of the vaccine that's been sent to our state, there has been 1,164,075 doses, first and second, Moderna and Pfizer, sent to Washington. According to the dashboard, as of yesterday, 616,589 individuals were vaccinated either with their first or their second dose, which is about 6.75% of Washington's population. An additional 130,650 doses went to long-term care, and they have this goal of vaccinating 45,000 people per day. we are only receiving 100,000 doses per week in the state. So big disconnect of the goal and the vaccine that's coming to our state. Our county has vaccinated about 7.28% of the population, so a little bit actually higher percentage than the state. And that's about 37,455 individuals with either their first or second dose. This week in the county, we received 4,600 initial doses. 4,000 of those doses went to the arena. So 600 was left, and they mostly went out to pharmacies. The health district did not get any. So we had a lot of things planned this week, and we're really trying to scramble on figuring out how many current doses we had on hand, and then where we could push back clinics. We have been developing some strike teams with Providence and using a couple of our contractors to fill in the gap around adult family homes in long-term care. And I believe that those are going forward. And then we have pack and go clinics with 4 shelters. And I think that those were also going forward. Where we're struggling is the school clinics that were set up for this week. We did have one out at Cheney with Medical Lake and Great Northern joining that one, East Valley and West Valley School, and Spokane Public Schools for their second dose. And then we have schools such as Ferris, Shadle, and Rogers next week scheduled, and the following week, Central Valley and Meade. So depending on our dosage, we're not sure how we're going to handle those. We also have the EMS Fire Training Center set up for the week of February 5th to the 12th to give second doses of all those individuals that were vaccinated the first round. We have been working with some target populations and have a clinic set up later on in the month at the Pacific Islander Community Clinic and the Martin Luther King Center for their food distribution workers. The health district ourselves, we have received about 6,800 total vaccines over the last 8 weeks and have vaccinated 4,295 individuals with the first or second dose. But depending on the supply, it will depend on how we go forward. Yesterday, Chaz did announce that they had vaccinated a total of 4,369 at their arena, and they've been given 7,000 doses total. So they'll start also in a couple of weeks providing the second dose to folks. That's it. That's my update. If anybody has questions.
Any questions for Lydia? All right. So Alicia, if you want to go ahead and do your update, and then we could just kind of keep going into that discussion topic you mentioned earlier, if you'd like.
Yeah, I think that's probably close to my update. Just we're fielding a lot of that kind of questions. I was trying to think about a question. Lydia's report is really helpful, and one of the other questions, and I've gotten 2 calls this morning on it, is it's a perception thing, and I think that that's part of what I'm trying to wanting to help with, is that we have a handful of large employers that are really engaged with the coalition in King County as well. And so their questions are questions around, how can we help? Do they need assistance? Do we have the infrastructure for vaccines? Do we, is there advocacy that we need to be doing? Do we feel like we're getting our fair share over here in Eastern Washington? It's those kinds of things that are popping up a lot right now, particularly from employers who are state and nature, and engaged with that set of employers who the governor's office is working quite closely with in King County. And so I would just say that we can sidebar that too, but I think that's how we can help buffer that or create clarity would be awesome.
Yeah. I actually think that's a really good point, Alicia, because so Dr. Velasquez and I had a conversation with the governor last week, along with Chaz and the Public Facilities District. And I think that we have the infrastructure for getting the vaccine out. I think the biggest hurdle, and Lindia really, touched on it, is we don't have the doses. So how do we kind of balance all of that, right? Because you want to be able to utilize the excitement that people have about wanting to get vaccinated, but then it's also kind of really frustrating when they can't get in to get the vaccination. So, I mean, I think that any ideas, or if business owners or businesses, have idea, I just don't know how we get more doses here. And I think that's the big question. And that's what we said to the governor, is like, how we have this down, but we don't have the doses, and we don't control the flow of the doses. So where do we insert into that conversation? I'm not sure.
Okay. Yeah, that mirrors my conversations. And I said, I know Dr. Velasquez and I had a conversation at the end of last week. I think that, the infrastructure is there, right? So it's a matter of the other pieces. And so I think the only other update I would just share related to that is that we, as I've told all of them in the last couple of days, we're kicking off, we have 6 different sessions. Normally we'd be in Olympia right now, and 6 different sessions with both legislators and agencies over the course of the next few weeks. And so it kicks off this week. So we do have an opportunity. We do have Senator Billig and Representative Frichelli on Wednesday, as well as Nick Struley from the governor's office. That's our hour discussion. So if there is, as we're shaping conversation and questions, all of you are invited. So I can certainly make sure you're registered and able to join us, but also as we're shaping questions, if there's anything from this group that we want to make sure we're continuing to double down on with either our legislators or the governor's office, I'm happy to receive that so we can include it in our discussion with them.
And I guess the one ask I would have is that they gather local input before state decisions are made, and better communication and transparency around that.
So Alicia, I wanted to add one more point that I think we need to make sure that our business owners, we're all aware, the community is aware. And I think it's because the fact that perhaps you don't see, meaning the community, you don't see other sites coming up. There might be a perception that the capability or the capacity to scale up is not there. So I want to dispel that rumor, actually, that concern. The reason why you don't see more sites popping up is because if we don't have vaccine, we're not going to get another site active and make it even more complicated than what we have right now. But we do have a line of sight to multiple sites. Actually, through the Spokane Regional Health District, we have access to over 300 volunteers through a medical reserve corps that are ready to go. And some of them have been deployed, but we have more, and we can certainly get a lot more. We also have in the queue professional students, meaning those that are going to be licensed, such as nursing, pharmacy, and medicine, ready to go. The issue is we need to get the vaccine so we can deploy them. So I wanted to make sure that we're all confident and comfortable in the fact that the scalability is there, if and when we need it. But because we don't see it, it may not be apparent that it's there. But it is there, and I don't know if you caught some of the detail of Lindia's. There's about 6 different ways that vaccine can be deployed almost instantaneously, which are active and ready to scale when we get the appropriate number. So I want to encourage our business owners, particularly, to make sure that they do have an understanding of what will a vaccine plan look like for their environment, their business, for that time when we can all move forward. And actually, I got now a few calls from some of our business owners that are already preparing based on the current phases that are being defined and anticipating, well, I think that we may be able to get X% of my employees in this phase. So let me see what that looks like. So I will encourage people to have those conversations, have those thoughts. If you have any questions, reach out to us. We're here to help, and we've helped a number of businesses with that thought process, because if they're ready, when we're ready as a community with a large amount of vaccine, then we can move fast. And the sooner we can move, the better. So the time to think about the future stages is right now, not when they get here. And I think we've done that thought process already. That's why we have the scalability. We're encouraging our businesses to do the same within the context of whatever their vaccine strategy is gonna look like. And we're here to help them or answer any questions or help them think through what it could look like, which we've done with a number of businesses. So I just wanted to put that in because I think that should be part of the conversation with our business owners.
Alicia, would it be helpful if, so Dr. Velasquez, Lindy, and I meet every day. We do like a daily check-in. Do you want us to maybe bullet point some of this and just send it over to you in email, just like, we have the infrastructure, what we need is doses, like kind of just summarize some of the comments we've made. And, like even to Lindia's point of, we've been, having conversations with the schools and doing a lot of work there. And then we don't control when they realign, like how the vaccine's going to be distributed. So since we don't have a voice in that, it's kind of, so now we have to go back to schools and change plans, right? So it's hard to figure out how you keep planning within the response if it's always moving, I guess.
Well, I'd say a couple things. Thank you for all of those. And I think the piece around the myth busting, I think is really important on that the infrastructure is in place. And I think for this whole group, not just for, the audiences that we're working with, I think the more we can all be advocating on those different pieces is really important. And then I think, we can, maybe let's offline, Amelia. I think one of the things I've thought about over the last couple of days is how do we have some increased communication right now, just because there's so much happening and it's changing so quickly. And so we can offline on that so that we can have some increased communication, particularly with some of this business leadership in the community.
That sounds good. Any other things we need to make sure we touch on in this meeting? All right, I'm not seeing anything. So we will meet again next Tuesday to go over everything, maybe get some updates, and hopefully our numbers continue to move in that right direction. So with that, I think we can adjourn and see everyone next week. And Alicia, we will get back with you on those topics. Right. Thanks, everyone.